All right. Good morning, everyone. Okay. All right. There we are. I was waiting for the my cue. I was off on my cue. Good morning, everyone. My name is John Wilson. I'm with Kansas Action for Children and also a Children's Cabinet board member. Uh, a little bit of a departure from the way things normally happen at our meetings today. Our chair, Don Heineman, is not available for this meeting. His wife, Betsy, is in the hospital, and that's where his priority is right now. Sounds like she will be able to come home soon, but would just ask everybody to keep Don and Betsy in your thoughts as they go through this. So I will try my best. As I told Don, I can be a substitute, but I will never be a replacement for Don Heineman. So we're going to go ahead and I'm going to call this meeting to order for the Kansas Children's Cabinet and Trust Fund for Friday, June 7th. The time is, what time is it?
9:01.
9:02 by my watch, 9:01. And we're just dive right in because we do have a full agenda today. We're going to start with the April board meeting minutes. I would look for a motion to approve the April minutes.
This is Lietta, so moved.
Thank you, Lietta. Is there a second?
This is Deanne. I'll second.
Thank you, Deanne. And any discussion or edits or recommendations to the April minutes? Okay. Seeing none, we will use a voice vote for approving the April minutes. All in favor of approving them?
Aye.
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 Wonderful. Let's move on then. We are joined by Owen Cox from KU's Center for Public Partnerships and Research, who will walk us through the Children's Initiative Fund's accountability process. Owen, take it away.
Absolutely. Thank you. And thank the board for having me back again this year to talk about this year's accountability process. Again, just to review, this is a process we go through each year to examine the programs that receive Children's Initiative funds and the work that they have done over the past year plus. All right. So that does bring me up into our timeline because this is one that we talk about each year because it can be a little confusing. I have to refresh myself on it each time. And so essentially what we are doing here today is having an accountability process presentation. We do recognize, however, that we are still in the current fiscal year. So programs have not actually wrapped up their services for this year. So fiscal year 24 is still in process. So what this means is that when I go through my slides, you will see some service provision numbers. Most of those are going to actually be from fiscal year 2023. And so that'll be noted on each of the slides. But as we think about the work that those programs have done, that is going to be from 23. We will also talk a little bit about what they have done up to date so far, just give a little hint at what we might hear about next year. But I did want to bring that up. The reason that we do this, again, is really part of the sort of legislative budget process where we need to start gathering information to make recommendations for next year's budget. And so the budget for 2025 is essentially finalized at this point. And the state agencies are now in the process of gathering information to send back into the budget office to make recommendations for 2026. So at the end of this process, when we go through all my slides, you all will be in a conversation about potential recommendations around Children's Initiative Fund and programs that it might fund. Keeping in mind that those recommendations will be for the fiscal year 2026. All right. Put that out there. We can go back over that as we get a little bit further into the information that we're going to go through. But I just want to put that out there at the start so we can understand a little bit about what we're discussing when it comes up. Okay, so talking just a little bit about the process and what we do to get where we're at here today. So we'll talk a little bit about the data collection. On your slide, you'll see some of the basic components for the accountability process. We request that all programs report their essentially any internal program reports that they put together themselves. So a lot of these programs receive funding from multiple sources. A lot of those sources actually have their own requirements when it comes to reporting. So what we try to do is streamline the process by requesting that they send us those reports as opposed to creating something completely new for this process. We recognize that these programs do a lot of work and we want to make this process as streamlined as possible for them. Other information that we gather is also going to come from the expenditures that come out of currently from the governor's budget report for fiscal year 2025. So information that you will see on the slides comes from that source when you see expenditure information or budget information for the programs. We do ask they fill out a survey for us each year, and this survey really gets at some of the service provision numbers, also some additional funding numbers for pieces that aren't directly from the Children's Initiative Fund and might come from other sources. So we gathered that information. We talk a little bit about service provision, where those services are available, and a few other pieces of information come from that survey. Finally, as I say every year, my favorite part is that we go through interviews for each and every one of the programs that is funded by CIF funds. So each spring, we have conversations with every grantee, talk to them a little bit about what was in their surveys and the program reports that we've gathered from them. But then we also gather a little information about what they've been up to since the last time we talked. So you will see a little bit of sort of an update or what's new on a couple of the slides. That's where that information comes from, by and large, are those surveys. All right, if we want to move forward one. Okay, so we'll just talk a little bit about the fund itself. So we're going to go into a little bit of the funding that we saw in fiscal year 23. So if we go to this the next slide, it's going to be our first slide on that funding, right? So this is the overall funding by agency. So you can see where the money goes. So all the programs are listed on that bar chart that you see there. And then on the left side, you can see which state agency receives that fund, and then for all intents and purposes, oversees that particular program. So you can see a lot of the money is with the Children's Cabinet and Trust Fund, but a lot of other state agencies receive money from this funding source as well. If we want to jog forward one more slide, we can also look at the same information, but looking at it by primary population. So of the funds that are put out by CIF, where do those go? As you can see, most of the funds go to that prenatal to age 5 range, so that birth to 5 or prior to birth to 5 population. So really targeting in on early childhood with a lot of the funds that the CIF puts forth. All right, next slide, I believe, is going to break down the funding, but this also has CIF. This also looks at the other funding sources that they give us information on. So you can see here the various types of funding and where those funds come from for these programs. As you can see, federal dollars make up a large percentage of how these programs are able to put forth their services. But importantly, I think we like to highlight every year that actually CIF is the second largest and quite large piece of funding for these programs. So without CIF, obviously, that would be very difficult to make up the type of funding that these programs need to provide the services that they do across the state. And then the next slide is just a visual depiction of that, I believe. And so you can just kind of see the amount of funds and sort of a visual depiction on where they are coming from. Again, with CIF being a very large piece of that, just behind the federal dollars. All right. So that's a little bit about the funding, and now we'd like to turn our attention to the programs themselves. First, I'm going to do a little bit of table setting before we move into the slides about what you're going to be seeing on the upcoming slide. You're going to have 2 slides for each program. The first slide is going to have a brief program description and a little bit about their service provision, and that's going to be great. On that slide, I want to also highlight there is going to be a URL link. So when these slides are posted after this, that'll allow you to actually use that URL link to go learn a little bit more about those programs. We're going to go through these pretty quick. We're just going to hit some real top-level highlights on each program. But if you want more information, there's a link there to give you a lot more information about each program and the work that they are doing. The second slide you'll see on each one is going to have a highlight of a couple impacts that we've heard about from these programs. So information about what they are seeing as far as the impacts of their services. And we're also going to have a little bit about what's next. That's that information that we gathered during the interview process that allow us to know a little bit more about what's happening currently. So up-to-date information as opposed to having to look back all the way to fiscal year 23 to understand the program. All right, I think we can now jump in to our first program. So focusing in on this first program, Child Care Assistance. This is a program to support families that are at or below 85% of the state median income level. And it's for them to be able to afford childcare by providing the family with subsidies while they work, further their education, or have an emergency need. And this program is really geared to provide supports to families so they can increase their financial stability. And so you can see a little bit about where these programs are being received across the state, some of their financial information, and then that service provision piece. So moving forward, to highlight some of the impacts on the next slide of the child care assistance. One of the things that we wanted to highlight is that, yes, indeed, 69% of the families receiving child care assistance while employed saw their earnings increase. So again, this is the key goal of child care assistance, is to increase the family's ability to sort of increase their salaries and their general financial stability. I did want to highlight one of the things that they were very excited about when we talked with them, is that during this past year, they really were excited about being able to clear a significant backlog within the agency of families seeking childcare. So families seeking that assistance. So they were really, they previously had a backlog that had been established, and they'd been working very diligently to get through it. And I am happy to report that they told us that they have now cleared that backlog. All right, the next program that we're going to look at is going to be the Early Childhood Block Grant. And I won't spend much time on this one, certainly because I know that next cabinet meeting, we are going to have an in-depth rundown and evaluation of what the Early Childhood Block Grant is up to. So what I really just want to highlight is that this program focuses on providing services to at-risk children in the early childhood years. Services include early childhood care and education, social emotional consultations, home visiting, literacy activities, and then also parent education. Just a few of last year's impacts that I can highlight here are that 77% of ECBG classrooms scored as high quality. And then we also saw pre-K and 3-year-old classrooms with high percentages of children scoring as on track for language comprehension, early literacy, and communication during that school year. And again, this is from last year's evaluation. You'll hear a lot more about them as far as this current fiscal year's that is wrapping up on their next one. I should say that this program is also continuing to collaborate across the system. So they're working to make sure that they are working with other state agencies to avoid duplication of services when it comes to the grant making and the funds to support early childhood. All right, the next program for us is going to be the Family Preservation Service. This program currently offers 2 tiers of services for families. All of those tiers are geared toward reducing the risk of children being placed in foster care. Family Preservation works with families to determine what scope of services best fits that family's needs. So it's really sort of customized to the family to make sure that they are getting the types of services they need to really achieve their goals of continuing to have those children in the house and not in foster care. Some of the impacts, if we want to move forward. These impacts that are reported from Family Preservation Services include seeing increased stability because of the supports, that they've received. And both tiers of services saw high percentages of children avoiding foster care placements during services. So again, hitting that ultimate goal of avoiding foster care placements. And so you can kind of see some of the stats there on that. They've also, interestingly enough, they did a process of evaluating their own program, and they determined that the tier system was leading to some additional barriers. And so in the upcoming year, they have a new RFP. They aren't going to actually have that tier system anymore. All the services will still be available. They just won't be in tiered chunks so that families don't have to navigate that extra level, or providers don't have to navigate that extra level of what services are available, which tier should they be in. So that's a change that is coming for them. All right, our next program is going to be the Kansas Early Childhood Developmental Services. And this provides early intervention services to children birth to age 3 in their natural environments who have a disability or developmental delay. This program has some interesting impacts, including the fact that yeah, perfect. Thank you. Including the fact that 99% of children in this program showed an increased knowledge and skills while in the program, and 95% of the families reporting the program aided in their child's learning and development. They also, as one of the new projects they have a joint initiative with the Kansas School of the Blind to serve children who are blind or visually impaired. And so this is providing them additional specialized services and connections with local programs that can help deliver services to them in their communities. So another great sort of update from that program. All right, the next program is going to be our Kansas preschool pilot. This program, as you might take from its title, funds school districts and community partners to set up high-quality preschool programs for children 3 to 5 years of age. And importantly, those programs also use evidence-based curriculum to serve those children and enhance their learning. Some of the impacts of the Kansas preschool pilot. seen for those enrolled in the programs include that 96% of the children showed improvement in literacy and or mathematics from the program's beginning to end, right? So they're gaining or improving in their skills by being in the program from its beginning to its end. They are also in the process of setting up some longitudinal tracking so they can really then follow those kids from the preschool program all the way through their education to see if there are any differential impacts for those kids who are able to participate in the Kansas preschool pilot in their learning and their achievements moving forward. All right, our next program is going to be the Kids Network. So this is another program that receives CIF funds, and it offers support services to individuals who have been impacted by the tragedy of infant death. It also provides community education, professional training, and research, all meant to strengthen the statewide infrastructure around infant death prevention and so education. So understanding ways that we can hopefully prevent those tragedies from continuing. All right. Some of the impacts of this program include this in fiscal year 23, they had 127 safe sleep events across the state, and those were held in 43 different counties. So quite a few counties were able to have safe sleep events in the fiscal year 23. And for the parents who participated in these particular events, they showed an increased commitment to safe sleep practices and also increased knowledge around tobacco cessation best practices. And then another important thing to highlight is through this particular program, they are also seeing gains in the number of hospitals and clinics who have safe sleep certification. So they go out and work with hospitals and clinics to gain safe sleep certification as well. They've been doing a couple different things as far as like their program, as far as evaluating it. They actually have a decent amount of different evaluation on the various projects that they do. But one of the things that they're doing right now is reviewing retention data for safe sleep instructors to better understand the difficulties in meeting program requirements and deliverables. So safe sleep instructors actually have to go through essentially like a certification process, and those need to be reviewed so that they are up to date on the most recent safe sleep sort of practices. And it's so you can get some turnover potentially. And one of the things that they want to do is understand, are there particular elements that are more difficult than others so they can provide resources around that. All right, the next program is going to be MCH home visiting, or sometimes referred to as universal home visiting. This is a program which is strength-based home visiting model open to any Kansas family with or expecting an infant in its service area. Families receive individualized care during and after pregnancy. And I did want to note here on this particular slide, as you, I guess you can't see fiscal year 2022, but this particular program received additional funds from CIF from fiscal year 2022 to fiscal year 2023. And the reason I want to highlight that is because I want to talk a little bit about that when we go to our next slide. We're going to talk a little bit about the impacts of the program. So we have seen that influx of dollars. The purpose of that was to try and expand the program and its reach. And so what I can report is based on an outside evaluation. What we saw from fiscal year 2022 to 2023 was a 31% increase in enrollment for families in that particular program, and a 44% increase in home visits made for those expansion grantees. I should note and highlight that I did talk with the evaluators during this process, and one of the things that they were able to provide to me is the fact that they are currently not done with fiscal year 24, but their projections are that they will see an additional 24% increase in enrollments for fiscal year 24 as well. And so I've highlighted the fact that they are working with evaluators down there and what's new, and they're going to continue to do that. They're exploring not only the expansion and how numbers served, but also understanding a little bit more about what are the barriers to expansion, what are the some of the reasons that expansion may take a little while. You know, you get the dollars right away, but sometimes it takes a little bit to fully come online. And so they're exploring all of those things with that particular program. All right, our next program is also a home visiting program. This one's Parents as Teachers. Parents as Teachers is an evidence-based model. It's designed to give parents the tools needed to support healthy child development. It emphasizes early childhood screenings as important ways to help identify areas of concern, implement interventions, and refer families to additional services. So if we go to their impacts, we'll see a little bit about that. As you can see there at the top, there was over 55,000 personal visits, leading to the identification of over 2,300 developmental delays or concerns. Importantly, the program also saw a retention rate of 88% of the family. So parents and families that get into the program tend to stick with the program and are able to receive the services and those connections within their community. They are part of a 5-year national review, and so they're going to make some slight changes to the program model. And so that's going to involve a little bit more work with the various affiliates to make sure that those changes are implemented so that those affiliates can retain their certification as parents as teachers programs. All right. Our next program is going to be the Tobacco Use Prevention Program. All right. This program uses evidence-based strategies as well as community partnerships to increase the public's awareness of the negative effects of and impacts of tobacco use, and it also operates the Kansas Tobacco Quit line. The program also works at the community level, and it does this to promote policy changes around the use of tobacco products. So various local policies that they can work on with local groups and agencies to try and change some of the policies around tobacco products in that particular community. Some of the impacts, I can highlight that in fiscal year 23, they did have 22 new local tobacco control policies implemented as through the work that they did with those groups. They also launched and developed the Young Lungs at Play 2023 Toolkit as a way to promote these policies for tobacco-free parks and recreational areas where children might be at play. They've added some new staff to try and increase their reach, and they continue to expand trainings and education to the workforce, including online training courses as opposed to just in-person ones. Okay, so that was tobacco use prevention. I'm going to go to our next slide, and this one we kind of previewed a little bit last year, and that is that in fiscal year 2023, there were 2 new programs or line items on the CIF budget, and so we're going to highlight a little bit about the work that went into those just slightly separately since they are kind of new programs. The first one is going to be this early childhood infrastructure line item. And this one is meant to support the long-term vision of the All In for Kansas Kids strategic plan. On the slide, you can see some of the projects that were funded in fiscal year 2023. And I should note that these projects are not static, right? These projects change to fill the gaps that are seen across the state of Kansas in the early childhood system. So just to highlight a couple of the projects that were on there. The funds were used to support 1-800-CHILDREN, and so that, as many of you are probably aware, is a centralized access point for services supports for children and families with children under 18. And that particular program or resource saw 81,000 plus contacts in fiscal year 2023. Another thing I wanted to highlight there was the one-time expenses for program support materials. These funds actually went to a couple places, but one of those places is the Family Forward Workplace campaign. And that campaign was able to reach over 300,000 businesses and professionals to provide information about family-friendly workplaces. So just wanted to highlight a couple of those as far as the items that were funds were used for from the early childhood infrastructure.
And
All right,
I
our
would
next
interject
slide.
here,
Yes, sorry.
Owen, if you don't mind. The infrastructure line
sure.
item is not intended to provide ongoing support for programs. It exists to help us fill gaps and meet needs so year over year, the work that this line item will support may differ because we are just trying to make sure that we are working across the system to provide the support and leverage opportunities as they come up. So the FY22 line item for Dolly Parton's Imagination Library was $500,000, and we had more kids enrolled by year end, so we absorbed some of that overage and then succeeded in increasing our line item appropriation for that. So you'll see next year this may look different.
And I see, Deanne, we have a question from you.
Yeah, just so, and Melissa, a question for you. So when these projects do change from year to year, is this something that we as a cabinet are voting on those changes, or is that an administrative decision based upon where you see needs or gaps?
It's really been administrative, but we certainly can have that discussion. You'll see that there are things in our budget that don't fit. So the accountability process has a line item in the budget that was set in 1999 and never has been increased. So you'll see some of that is absorbed in this infrastructure line item for the CIF contract because we used to take it out of the grant funds themselves. So it would reduce the amount of money we had to award for early childhood block grant awards. The decision once we received this ability to manage the admin pieces differently, some of that I will always prefer we take out of infrastructure as opposed to reducing the amount of grant awards we can make.
Okay, thank you.
But if we can talk about this. We're going to have a cabinet retreat. There are processes that I would welcome conversation on if you would like to adjust the approach to things. We can figure that out.
Oh, and this is Monica. Can you repeat what you said about the Family Forward campaign and who is running that? I'm not familiar.
Yeah, it was a request from the Breastfeeding Coalition, and it's to help promote family-friendly workplace policies. So where
would I find the information so that I can help distribute it?
The information is online, so we will make sure that we send that out to you and make it.
But it's the Breastfeeding Coalition.
It's its own thing. We'll get you the link, and I'll make sure our cabinet website, it should have a link to it. The allinforkansaskids.org website should have a link to it, but we'll make sure
it's probably there. I'll just Google it.
Specify it for you. Yeah, it's a really I think it makes it accessible for employers to understand it isn't a heavy lift to be a family-friendly workplace. It just requires some accommodations. And you see Amanda joining us with the ability to bring her infant to work for a couple months because this is such a critical stage of life. That is a family-friendly policy that an employer can adopt. Having dedicated space for a breastfeeding mom to be able to manage during the workday, et cetera. So yeah, we'll make that. We'll feature that in an email to all of you and on our website.
All right, if there are no other questions, Owen, feel free to proceed.
Absolutely. That was a good place to pause because I think we're going to go to our next new program, which I think is pretty near and dear to a lot of people's hearts. So this is the Imagination Library of Kansas. This is the program that puts forth Dolly Parton's Imagination Library. And so I know that the cabinet will be talking a little bit more about this later today. But I did want to talk a little bit about it. And actually, I'm going to provide it a little bit of more information around it because we've got some exciting stuff that is happening around the Imagination Library of Kansas. So first thing I want to say is that its basic idea of it, right, is the Imagination Library of Kansas provides books to children free of charge to children from birth to their 5th birthday. And as you can see on the map right here, at the end of fiscal year 2023, so literally the last day of June, fiscal year 2023, we had nearly statewide coverage. However, funding was released for fiscal year 2024, which allowed for statewide coverage to be basically achieved the first day of fiscal year 2024. And you can see there the change in funding from fiscal year 23 to 2024. Melissa mentioned a little bit about the fact that because it was expanding so well, we did need to use some of that infrastructure line item in 23 to meet the needs of the match for this particular program. And so in fiscal year 24, the amount of money going to that program was upped, and then it did allow it to achieve statewide, I guess, impact and coverage for that particular program. And so if we want to talk just a little bit about the impacts from fiscal year 23, and you can see some of those right there, right? So nearly 20,000 new signups for the program, so nearly 20,000 newly enrolled children in the fiscal year. And that includes over 500,000 books distributed directly to children during that particular fiscal year. And as you'll see here in a second, we'll talk a little bit about the impact as far as the children who are able to participate in that. The other exciting news as far as what was new last year, some of you were able to participate in the welcoming of Dolly Parton to Kansas to sort of celebrate the successful statewide expansion of the program. And then also another thing that you all will be talking about here in not too long is the establishment of a 501c3, which was really meant to improve the velocity of being able to bring in funds and manage the statewide implementation of this particular program. So exciting stuff happening not only from fiscal year 23, but also into fiscal year 24, and hopefully into the future as well as we move forward with the program. But I also want to spend a couple more slides talking about Imagination Library of Kansas. And that is because right now, an independent team of evaluators, I do not take credit for their work, but an independent team of evaluators is doing an evaluation on the impacts and the reach of Dolly Parton's Imagination Library, in particular the Imagination Library of Kansas and its implementation in our state. And so what you'll see here is a first slide that looks at where the state was as far as coverage in May. So I want to make sure I get my dates right. This is May of 2023 because you just saw a stat about the end of the fiscal year, but this is in May of 2023. We want to have a one-to-one snapshot. So this is May of 2023. And what you see here is at that point, we had about 27% coverage in the state. So 27% of the eligible children, so children birth to 5, were signed up for the program. That meant about 50,000 children across the state and as of May 2023 were signed up for the program and receiving books. So if we move forward, one more slide, this is the change. And while I'll say it may not look that much, you should be able to notice that a lot more deep green is starting to occur. So this is a snapshot now of last month, so May of 2024. So we're going May of 23 to May of 24. And what we see now is that 42% of eligible children are now enrolled, right? So that's 27 to 42% in the course of a fiscal year. And a little over 75,000 children are now receiving books from the program. So from 50,000 to 75,000 over the course of a single year. And so we are seeing the expansion, the efforts of this program, the additional funding, the campaign to get the word out about the program do appear to be working in the state of Kansas. All right. So we did want to do a little list here of the programs that are above 65% of eligible children being enrolled. The reason that we're highlighting these programs or these counties and their enrollments is because 65% is what the Dolly Parton Imagination Library of Kansas, or excuse me, of just Dolly Parton's Imagination Library considers to be full enrollment. So when you achieve 65% of your eligible children within a particular geographic region, that is what they consider to be full enrollment. So we have all of these counties here would be considered fully enrolled in the program. So obviously, for those of you on the call or listening, if your county is not listed here, perhaps reach out to a family and give them a little bit more information about the Imagination Library in Kansas and see if they might be interested in enrolling in the program.
Owen, I would just say the success in areas that have higher enrollment really is thanks to local partners that work on the ground in concert with our state level promotion. When we have active and engaged local partners, we see the engagement with families in their area and higher enrollment for the kids. So I would like to put a plug in to anyone thinking that this might be a great project to focus efforts on. Reach out, let me know, because we're always looking for stronger partnerships at the local level.
Absolutely. Thanks, Melissa. All right, I think if we move forward to our next slide, I'm going to do a little table setting on this one as well. Okay, so that independent team of researchers and evaluators that I talked about previously, one of the things that they have been able to do is connect Imagination Library of Kansas participants to children who are enrolled in ECBG. So what they have done is they've made a comparison for kids who are dual enrolled in the Imagination Library and ECBG, and they are comparing them then to children who are just enrolled in ECBG. All right, and so what we want to do is then highlight some of the information that we've been able to gather. I do want to note that this is still just a preview of this evaluation. The evaluators are still finalizing all of their impacts, materials, and reporting, and so that'll be available later this year. But I did want to make sure that I am noting this is just a preview. It's going to go much more in depth than I'm sharing here today with you, but this is just an initial look that we wanted to share with you here today. So what we see here is that those children that are in ECBG and in the Imagination Library of Kansas tend to have more special needs or tend to be more highly enrolled in Part C or Part B coverage. So just a little bit of sort of some of the demographic breakdowns of these particular kids. If we want to advance to the next slide, what we see here is also that children that are dual enrolled tend to be a little less diverse on some of these measures than do children who are simply ECBG children. One of the things I did want to note here, though, is that just recently, the Dolly Parton Imagination Library has been piloting a program in California where children can sign up for bilingual versions of each book. And so they've been piloting that to see if that can increase the enrollment of individuals with different language preferences. And I'm happy to report that Kansas has been selected for the next phase of that rollout. So we're hoping that we can see some changes in the numbers there as well as we try to reach more kids who might speak slightly different languages or might speak different primary languages in the household. All right. Okay, so here is one of the more exciting findings that I get to preview for you here today. And again, this is looking at dual enrolled children, so children who are enrolled in ECBG and the Imagination Library versus children who are in ECBG but not in the Imagination Library. And so the first thing that we want to look at here are sort of those ECBG and dual enrolled Imagination Library students or children. And so what we see is actually that at the first measurement, kids who are enrolled in the Imagination Library actually come in with higher levels of higher percentages of those children are coming in sort of, they call the strong progress, but what is like the top scoring level for the picture naming skills task, which is part of early literacy measure. Those children who are dual enrolled also see greater progress when we do the follow-up measurement. So what we're seeing is that children who are dual enrolled, who are receiving both services, so who are stacking essentially services, have better outcomes and make better progress on this particular measure of early literacy. Now, that's not to say that ECBG children are not making progress, because they certainly are. You can see in that particular graphic that they are still making progress by being part of that particular program from baseline to follow-up. But we're seeing is that stacking of services actually leads to higher level outcomes for those children who are able to receive both programs. And that's just one of the measures that will be followed up by the evaluators. I just wanted to share this one here today with you because it was one that we were excited about when we saw when they gave us our preview. There's a lot more information that'll be released once we have the full evaluation, but I thought it was really great to see that, yes, indeed, if we were able to provide more services to children, they tend to, at least in this instance, perform better on measures like this one for early literacy. Okay. And that is my last slide on Dolly Parton. Oh, yes. Yeah.
Oh, and sorry, it's John Wilson. I don't know if Melissa, you wanted to interject something, but on that last slide, where did my question go? Is our ability to do this type of evaluation possible because of our data trust, like data sharing, or
So this first round of evaluation is really the result of a data sharing agreement between the Dollywood Foundation and the Children's Cabinet that allows the foundation to share 10 years worth of enrollment data in the Imagination Library with us at the cabinet. And then we have permission, we have a project plan that allows the evaluators to process the data and match it up with our ECBG data. The next goal is to work within the data trust with starting with the Department of Education. We will need a new or an amended data sharing agreement with Dollywood Foundation to share any of the data with KSDE. But as that agency develops the state early childhood longitudinal data system as part of the overall data system that houses student data, the goal would be to be able to share the enrollment data with KSDE and then when you have a cohort that's 10 years worth of enrollments, you then begin to track other measures through the school years and anything from obvious reading scores, et cetera, to the ripple effects. Our attendance rates better, the need for services through special ed minimized, are the graduation rates higher. We see Dollywood having done studies that precede ours in other states, and they this spring will be releasing an international research project that shows the efficacy of this very simple program with all kinds of outcomes. They are super excited. I haven't seen a preview yet, but I have just, this week found out that they are finalizing this study. So we hope to have a Kansas-based study to show the value of something as simple as gifting a book so that families have that resource in their home readily available and can promote reading with their children. And as Owen mentioned, the bilingual program, Kansas is in the next round of rollout. They're just making sure they've got they added 5 states this month to make sure their book order system can manage the differentiation between, hey, we want our kids to get bilingual books versus the pool of folks that just want English language. So it'll be Spanish, English as this first effort to get more diversity within the population. But we're excited to then begin to focus with partners that serve Spanish-speaking populations in Kansas to help ensure all kids can benefit.
Thank you. Monica, I saw you come off mute. Do you have a question?
Owen, are you talking about a one-to-one match, student match? So that this kid in ECBG and this kid on DPIL and their data, or is this a bigger analysis?
So this,
or if it's better to talk about it later, that's okay too.
I think we can certainly. I will caveat this with it's not my analysis. So my understanding of the preview of this was that they are looking at 10 years of information for kids who were both in ECBG and DPIL. So that pool of children versus the pool of children who were only in ECBG for this.
So it's a pool. Okay, thank you. That's still fantastic information. Thank you.
Okay, I think then I only have a couple more pieces left here, and that's to get to the key takeaways. So again, we're now expanding this back out to takeaways from all of those CIF grantees and talk a little bit about what we see from them again this year. And so if we want to just jump into sort of our main takeaways. Again, I think we talk about this often, but CIF funding and the programs it supports really do provide critical services to children and families in Kansas, in particular trying to spur forth their healthy development. we see this from our conversations directly with the grantees and the information they provide us, but they really do highlight that again when we talk with them. They talk about how parents often talk about how without these critical services, they don't know how they would achieve the things that they can, and that and to be frank, that they still need additional services, right? But these ones that are certainly critical to them. And the next highlight that we see again and again from the grantees is just that it's difficult to sort of staff some of the work that they're trying to do. This is in particular, we saw when we try to, when they try to expand programs, right? Trying to get new staff in the door can be a difficult process. And we also have turnover for staff that are currently there. So as we try to think about expanding the impacts of this, we really need to think about how we can support the workforce to make sure that we can do that. Again, CIF families, as I said just a second ago, they report resiliency. They talk a lot about the achievements that they can make, but they still have basic needs that are remaining unmet for too many of those families. And so we see that from the information that's provided to us by these programs. And then finally, this was, we talked about it somewhat as an emergent finding last year as a key takeaway from our CIF accountability process. But this year it was really highlighted once again, and that's that programs are expressed a continued need for additional mental, behavioral health and resources for children, family, and staff. So it's not just that the kids have additional needs that they had not seen before, but it's really that there's additional needs across the board when it comes to the people who are involved in this system. So it's something to keep in mind moving forward as that continues to be something that is highlighted by programs. Okay, I think I will pause there. I think that is my last slide. And so I can pause and see if there are any additional questions. Otherwise, I'm going to toss it to Melissa.
John, I see.
Looks like we have a
yeah,
question from Lietta.
Thank you. Thanks, Owen, for the great presentation. You mentioned something early on about the programs collecting their own data, and then we use that data so that we don't cause extra work for them. So can you talk a little bit about, I'm a long timer on the cabinet. We've always been super proud of our longitudinal data collection. And what's the difference between these programs and the ones that we collect? Is it the DAISY program that we use to collect that longitudinal data is so valuable? And why do we not have these programs do that?
Yeah, that's a great question. I think part of it is because they offer, so these programs offer quite different services between the programs themselves. And certainly when you mentioned DAISY, that often refers to the early child, yes, ECBG grantees, yeah. And so ECBG grantees, we are able to do that. That's a sort of a program, if you remember that top line in the bar graph, that is one that is sort of directly falls within the children's cabinet as far as the, I guess program.
Owen, you on a lifeline?
Sure, yeah, absolutely, Melissa. I will take one.
So, Lietta, the programs the cabinet actually administers and oversees, we have the ability to make the data requests and require participation in our Common Measures Initiative using DAISY as the portal. For the programs that transfer as line item transfers through the CIF to the other state agencies, the agencies understand that statutorily they are required to coordinate and work with us to report as part of the annual accountability process, but we do not have the same ability to embed criteria in those programs for required data participation. Owen was also speaking to, common measures wouldn't be applicable to some of these other services and programs, so it wouldn't be appropriate anyway. But it's just a matter of trying to work with the agencies. The reason we ask for existing reporting is they all have their own funders and federal funding sources that require reports and data and that sort of thing. So we're trying to coordinate and not add additional requirements that are time consuming and eat up staff time. But it really is, it boils down at heart to a control issue. We are not in control of what is set up for other programs in terms of reporting and data collection. I would say the CIF and this accountability process and the information we do receive certainly is an improvement over direct transfers that sometimes get made from the key fund out to outside places. Those destinations, we have no statutory authority to ask for data or information. So certainly within the CIF is better than outside the CIF.
Yeah. Well, thank you. And it's not like data is not collected. It's just not the uniform.
It's right. Yeah.
Measure.
Yeah, there's lots of good data, but it isn't under the Common Measures Initiative is for our own ECBG grants.
Great. Chairman, can I ask one follow-up separate question?
Please.
Thank you. Would it be safe to say when we have the line items that have flags as maintenance of efforts on our budget, are these most of those maintenance of effort items, or is that just too broad brush of a statement to say?
Can you repeat that question? So you're asking about the items that we highlighted in kind of a salmon color on the budget table that we flagged at. The funding from the CIF is serving as all or part of the state required match and or maintenance of effort for those programs.
Therefore, it's kind of untouchable. We don't have a lot of wiggle room. Is it these programs that we just reviewed in general, or is that too broad brush?
We certainly could you as a board could make recommendations. We don't have the power to make changes. We have always tried to be a good partner with the receiving entities and not blindside them with recommendations they weren't expecting. But there has to be effort if we don't want to lose federal funding. If not CIF, then somewhere else. There has to be budget capacity replaced elsewhere. So it could be state general fund dollars that get added. That we have seen that happen in the past. So it's not that you don't have the authority to make a recommendation. If you desire to see some of that switched out, this board meeting and your vote on what you see as CIF priorities is the time to make that case. It doesn't mean we make it all the way through to the final state budget, but it certainly that is the point. You as a board should take the accountability report into consideration as you think about the ways our CIF dollars might be utilized and what you wish would happen. That's what your recommendation is your wish list.
Okay, thank you so much. Great report, Owen.
Thanks, Leota.
Can I pause?
Sorry.
I know there's probably plenty more questions. We have a board member who needs to leave in the next few minutes, Delise Hofen. I want to thank you for your service these last 4 years. You are serving on our board as our speaker's appointment, and your term is coming to an end. The speaker has made a new appointment. So this is your last meeting with us. And I just wanted, we don't have a lot of pomp and ceremony when it comes to these things, but an acknowledgement of what a delight it's been to work with you and how much we appreciate not just the work you do for our children's cabinet programs, but in your everyday life, you are doing amazing work for the cause of fighting cancer in children and bringing research forward to make sure kids don't continue to suffer from that disease unnecessarily. So if you want to say a few words, please feel welcome, but I just wanted you to know how much we appreciated our time with you.
Well, thank you, Melissa, and thank you, group. So I am sad to leave. I have enjoyed my time on this board. I have appreciated the opportunity, and it's been an honor to work with you guys at the KSDE staff and with this board. I have always appreciated the transparency, the honesty, the integrity, and the hard work that this board puts to put children's needs in Kansas first and to do the right thing to support them. So I wish you guys all of the best moving forward. And if there's anything that I can do as a private citizen outside of the board, please never hesitate to reach out to me. Send me an email or give me a call. And I am definitely happy to support and advocate the work of this board and all that you guys do. So thank you all for the opportunity. I appreciate it. And I wish you all the best.
Thank you. All right, back to our regularly scheduled programming. Board questions about the accountability report.
Well, Melissa, this isn't actually a question about the accountability. I do want to just layer on the gratitude for Delise. Delise, it's amazing how quickly 4 years go, and it's in my mind. I'm like, oh, we've got plenty of time to connect with each other and to build on our experience together during these meetings. and obviously time flies by, but I just want to say that I appreciate your kind of thoughtful and calm presence at all of our meetings. And that really goes a long way. And I love how that has really become a way that this board operates, is thoughtfulness and kindness and patience and gratitude for the work that many others are doing. So Felice, again, just today as the board chair, I want to thank you for that as well. And I know Don would share something similar too. Okay. Owen, you might have been able to get away without any further grilling on these key takeaways or the accountability update.
All right. Well, thank you so much, John. Obviously, if there are additional questions, please feel free to reach out to me or Melissa. We'll definitely do our best to follow up with you and provide you any additional details. I did want to, back to sort of Lietta's question just for a second, I did want to note that we do continue to track how the CIF grantees are performing across time, but we don't have specific common measures for them. So I believe it was 4 or 5 years ago, we did sort of a 5-year review of the programs. And so we do have a little bit of longitudinal data in that way, in that we have a sort of a history and a context of the program. But all the things that that Melissa said about sort of the common measures do apply to those grantees that fall outside of KCCT's F's administration. So just wanted to put that out there as well. And then just thank you all again for allowing me to come here and present with you.
Thank you, Owen. Melissa, take it away.
Well, thanks, John, and Owen, thank you and the team that put all this together. It's collecting the reports, it's evaluating the information contained therein, it's meetings with the CIF grantee lead entities, and lots of time and effort spent to make sure that we give you a really solid snapshot of the performance of these programs to the best of our ability. It's time now. I want to do a quick reminder, probably less for the board members themselves as it's for the overall public to understand the reason we are taking up recommendations today for the state fiscal year 26 budget is because of the life cycle of the state budgeting process. Recommendations from the Children's Cabinet Board are part of our role and responsibility to advise on the use of these funds. So we use our annual accountability report as the baseline for discussion about our Children's Cabinet budget. We have an MOU with the Department of Education, which puts our budget inside of the Department of Education's budget. That means we have to get ahead of their process for adopting the agency budget, which involves their state board of education. So we have to get our recommendations done in June so that the state board can then begin to review their overall budgets. I think they get an informational briefing in July, and they make their budget decisions at their August meeting, if I have that time frame correct in my head. They don't interfere. They don't go in and change what the Children's Cabinet Governing Board recommends, but our budget has to be adopted in order to be contained in their budget. All state agencies have to have budget recommendations to the Division of Budget no later than right around September 15th. It's mid-September. And then the Division of Budget does the things they do to create the draft budget document based on agency recommendations. There is an annual period of it's the appeals process. The Division of Budget will schedule 15-minute timeframes to meet with agency representatives to listen to the rationale for any items that are different for the new fiscal year from the prior fiscal year. So they have a baseline understanding and then can go into the meetings they have in, it's usually starts in, I can't remember if it's November or December, when they have their budget work with the sitting governor. So they have to be able to describe in the meetings with the governor what the changes include and why they're being recommended. And then the governor sets the budget document that is her governor's budget or his or her governor's budget recommendation for that fiscal year to greet the legislature when they come back in January with a budget to work on. And then it's the legislative process that actually appropriates the funds that make up the CIF budget. So we are, the legislature just a few weeks ago adopted the final version of the state budget for fiscal year 2025, which will begin on July 1st. The month of June is the state budget closeout process, which is a heavy lift in the world of state agency administration as we work through the changeover process and the mismatch of timeframes, and there are blackout periods where nobody has the ability to process anything because you have to have time for the IT folks to change the things in the system for the new fiscal year. So we do a lot of juggling in the month of June to make things work. And the new fiscal year in terms of payroll begins with, I think, the next pay period. So there's a lot at stake behind the scenes to make the budget process work. And so that's why, even though we are currently in state fiscal year 24, we need to have budget recommendations for state fiscal year 26. And you're basing it on an evaluation of the performance of programs in fiscal year 23, because that we are not done with fiscal year 24 and we don't have all the data that we would need to provide that. When I arrived at the cabinet in 2019 in this role, the cabinet board was making these budget recommendations in December so that they could do it based on the data from the previous fiscal year. But at that point, it was too late to matter because all of that 6 months worth of budget work had already transpired. So we just tried to reorient the process 5 years ago, so that has been the cadence of these recommendations. Lots of background because I want people to understand why we're dealing with all these different fiscal year dates and timeframes. So this is not a complicated recommendation. Lindsay, if you could advance. We need a basic budget recommendation. So when it's time for a motion, these will be the words. And then the next slide, the budget table for FY26 will constitute the content of the motion. But before we get there, we have things to discuss and review and make sure everybody understands and agrees should be part of the recommendations or not. So that is board discussion that we're about to embark on. You have seen these programs before. We just had an update on how things are going. I think, for the last 2 years, we have had flat funding. We have tried to maintain steady across the board funding. That is the baseline starting point for the FY26 recommendations, put there as the placeholder. It is not my call. It is your call whether there are changes or not. The 2 items that have TBD in FY 2026 were line items added not by recommendation of this board, but they were part of the larger budget process. So the governor's budget included some new items, and through the legislative process there was some evolution, and this is where we've landed. So that is the first time those 2 line items, the child care health and safety grants for 1.3 million and the workforce registry support for 1.1 million. The $5 million public-private partnership there's language in the state budget that is a one-time occurrence. We're not going to do that again. It was originally in the governor's budget to come from state general fund dollars. Decisions were made to shift that to tobacco funding, so that money comes out of the FY25 transfer. And so I want to make sure expectations and understanding is consistent across all of us, that this is not set in stone. This is up for discussion, and your recommendations will represent the wishes of the cabinet as the budget process unfolds. Unless there are questions about specific line items, maybe it would help. Lindsay, I don't remember the next slide. Is it? Yeah. So this is the updated version of that bar graph that shows, based on the consistent funding across the board in the programs, without the 2 new ones, we would have a $54,252,261 transfer from the key fund into the CIF, and then the KSDE, KDHE, and DCF transfers pass through to those agencies. This is the snapshot of that dollar amount across the age breakdown, the population breakdown. And then, just so that we have the right frame of reference, I have the historicals of these figures dating back to the inception of the cabinet, but it became inscrutable on screen. So to do 25 years worth of data and make it legible, this is 15 years of data. So the green graph, the line at the top in green, is the annuity that we receive as a state for the master settlement agreement. The yellow line is the annual transfers since 2011 from the key fund to the CIF. The tobacco funds land in the key fund, as a reminder. So the annuity that we receive, the transfers out for the CIF, and then the blue line at the bottom shows the key fund ending balance year over year. So I just last week, after I'd sent your prep materials, Division of Budget sent me the current numbers, factoring in all of the movement in the state budget. Our ending balance in the key fund will be at $11 million in FY25, and the consensus revenue estimating group has downgraded tobacco sales for the coming year, and also downgraded the estimated amount for the annuity for the key fund from the tobacco settlement. So this is part of a trend line that has been predicted since the settlement was entered into, that there would ultimately be a reduction in the revenues generated as part of the settlement. It's a national formula. The sales have to be tracked in every state, and then all the numbers are calculated according to the settlement terms to come up with the amount that each state receives in the annuity. This is the sole source of funding for the Children's Cabinet, the Children's Initiative Fund. So I thought it very important for all of you to have this context as we sit down to have our budget conversation to get to your recommendations. So maybe it would help to go back to the table. And John, I will give it back to you to chair the discussion.
All right, thank you, Melissa. And thank you for the slides. And Lindsay, perhaps be ready to dance between slides if board members have questions about things. I think in particular that last slide that from my reading looks like a structural imbalance for the long-term health of the Children's Initiative Fund. But I would open it up for this, maybe to be official. We might want to, I would imagine, have a motion to some sort of motion and second, and then we have discussion, or do we want to have discussion and when we hone in on the type of recommendation we want to make, then we can do the procedural work? I'm open to either process.
I'm happy to make that motion so we can have some discussion.
Okay.
Motion to approve as presented.
Monica has made the motion to approve the FY26 recommendations as presented. Is there a second?
Lietta, second.
Thank you, Lietta.
John?
Discussion.
Yeah, this is Monica. So I have 3 points written down, and I don't necessarily need any of these to be long discussion points, but number 1, I know we can't do anything this moment, but flat funding to locals, to programs is problematic. We keep saying, oh, it might get better, it might get better. And the assumption that all those folks that are out doing the work that we just lauded a minute ago can continue to do it for the same cost is just, short-sighted on our part. It's realistic on our part. I get that. But we have got to address that at some point in time. So I would like for us to consider looking at early on, looking at these numbers and saying, what is it that we can do when you look across and the numbers are the same over 3 years? It's not sustainable. It's not right. And I'd like for us, when the time is right, and maybe it's at our retreat, to address that. Staff costs alone, it's just not realistic. And we need people working on the ground for us. And we have to recognize that costs money. That's number 1. Number 2, as we look at that instability on that chart, that final chart, I'd really like for us to consider the conversation about transfers as it relates to, more administrative type things. And again, look at maybe during our retreat, those transfers that, again, meaningful work being done by partners, but looking at that as specific strategy. And I think I might make a motion here in a little bit to consider that, just as a thought of purpose rather than an intentional line item here. And the number 3 thing, again, this is more of a weedy situation, but that workforce registry line there, I'm going to say I know a lot of people are working on it. I know it's important, but golly Moses, I'd sure like to know when that endpoint is and that implementation date is. I understand completely the importance of it. As somebody who has collected professional development hours in file folders. I mean, I get it. But I'm just, at some point in time, maybe it's appropriate to know when we're putting a dot on that one.
Should be
Thanks, Mr.
October.
Chair.
Just FYI, this fall we should have that rolled out. We've opened up the QRIS module to providers for
Okay.
quality improvement activities. The full registry, we are hoping and working towards a goal of October to
So the 1.1 million pushes us over the line. Is that what it's doing?
Yeah, there's a lot that lives in building an online system. So this is helping with the process of merging all of the functions into one place and getting online. So yeah, I appreciate
Thanks.
your comments.
Thanks, Mr. Chair.
Yeah, of course. Monica, I appreciate those. So it sounds like perhaps we can have this recommendation on the proposed budget, and then if you have other comments you want to share, another recommendation later, we'll get to those. Other discussion from cabinet members. Not seeing any. This is John. I will say, Melissa, you indicated it earlier that if we were to make a recommendation today that really altered these items in tan or whatever we're going to call those, cream colored, it could if we were to make those recommendations without ample heads up to our agency partners, that could really throw them for a loop. And I appreciate our thoughtful approach to that. As we have those partners listening to this, and then as we have conversations with them outside of this meeting, I would invite agencies to really also kind of advocate for this position as well. I know it is uncomfortable to ask for more funding and know that that's also competing with other priorities that agencies have, but we are all in this together, and we have, I think, an incredible portfolio that is evaluated and is a rigorous process. And if we could free up more funds to support that portfolio that is squarely focused on the most critical years of development for kids in Kansas, then I think that would ultimately be better in the long run for a lot of agencies who might inherit additional burdens or cost burdens or other things through investments they have to make for kids who haven't had the ability to participate in high quality early learning experiences. So to land the plane on that comment is, I think it is important for us to advocate for eliminating some of these transfers and then having them replaced with SGF, and then for leaders in those agencies to embrace that idea, especially at a time where we currently are, where there is a relatively healthy ending balance with our state budget that certainly won't be there forever. But I'm also witnessing efforts where we're trying to lure a major sports team to Kansas, and we're willing to forego revenue for something like that. And I really would like to see leaders act with the same sense of urgency around kids. We may not be able to have the same lobbying effort, but this is the most important work that we can be doing as a state. So that's probably the most animated you'll see John Wilson get. But I just think it's really important, and we shouldn't be embarrassed or feel any bit of hesitation to say our kids deserve $10 million more, or how I add up all these transfers. We can come up with that money as a state for state general fund dollars.
Mr. Chair, one more thing. So as I know there's a lot of folks that do this important work for us listening in. As you think about telling your story, we obviously ask you for a lot of information, and we ask you, so many things, but if you could consider how you can, in a really short email, explain, hey, flat funding means blank less people, or blank years of no increase in salary, or 50 less children being served, or 5,000 less miles being driven. You know, bullets are lovely. Let me rephrase that. Bullet points are lovely.
All right. I'm not seeing any further comments or discussion on this particular recommendation. Monica, would you like to close on your recommendation?
I close. Do I have to say that? I haven't said that in a long time. We don't
Let's
use
do
those
it.
words here.
You know,
Let's vote. How about that?
let's do it. Okay, so I think we have a slide for this one.
Yeah, the vote we do. This will be a roll call so that because it's a funding question.
Yeah. All right. So we now have the slide up, and we are all in favor of Monica Mernan's motion to approve the FY26 budget recommendations. John Wilson.
As presented, right?
As presented, yes. John Wilson, aye. Dr. Tyler Smith.
Aye.
Monica Mernan.
Aye.
Deanne Owen Graham.
Aye.
Dr. Leetta Felter.
Yes.
Senator Renee Erickson.
Yes.
Thank you so much. The motion passes. The recommendations are approved.
While we're on this topic, Mr. Chair, would it be appropriate? I was looking at the three things that I mentioned, and I'm thinking the flat funding conversation isn't really a statement of, you know, we can deal with that in a retreat, and thanks for the update on the workforce. But on the transfers, would it be appropriate for us to at this time make like, I don't even know who we would be recommending it to, but it is kind of a place in time, a point holder to have a discussion about, not a discussion, but maybe just a statement about the reduction causing our concern, and that the transfers, because they are something that are right in front of us, look at a statement around not doing that. I've put together a couple, you know, little thoughts here, but I want to just see what the feel of the group is first. If it's not anything we need to make a motion on and study more, I'm totally open to that, but it kind of sticks out to me as kind of a, you know, first thing we could look at.
Yeah, thanks, Monica. And so if I understand your thinking right, we have the key fund where the MSA funds are deposited into, and that's sitting at about $11 million. There's the practice right now is there are direct transfers from the key fund to specific agencies. And then there is a transfer to the Children's Initiative funds, which we just then approve the budget for. So as to not have this continued decline in the corpus of the key fund, you are interested in a recommendation maybe that prevents those direct transfers to anywhere else other than the Children's Initiative Fund. And anybody who is impacted by that, any agency, would then simply build into their budget recommendations due on the 15th an amount that makes up that difference. Is that?
That's way more articulate than I said, yeah. And maybe we're not ready for that. You know, maybe we need, you know, more information. Maybe we need to discuss this at our retreat, but it was just percolating as we were going through the process. So
from a process standpoint, I would say the necessary vote has been taken to get to a baseline budget recommendation. We as a cabinet board, at any meeting, any member is always welcome to bring a recommendation forward regarding policy positions this board wants to entertain or adopt. That is fair game and part of your role and responsibilities at any given meeting. So what we put on screen gives you a snapshot. The yellow line is transfers out, the green line is transfers in, and we are structurally, like, we are in a dangerous place to be taking more than is coming in annually. So I can work to prepare whatever kinds of information might help. We could do this today. This is up to you all. It looks like Leetta
has a question.
Yeah.
Well, I wanted to say, as we're talking about the retreat, that I would love to look at the key fund, where the dollars are invested while they're percolating in the fund and not being swept into other funds.
The CAPERS governing body invests the balance in the key fund and manages those funds for us. So it's all their protocols for how monies are handled on behalf of the state. We certainly could gather some information from CAPERS if you'd like some detail on that. I'd be happy to work with them. We have in the past talked to some of the other agencies that receive key fund transfers to learn more about their operations. So I'm happy to gather whatever types of materials will help inform a healthy discussion.
I would support what Monica's suggesting. Just the more we know as a cabinet,
Okay.
the better we are, I believe, in making decisions and advocating on behalf of Kansas kids.
I think that's great.
Melissa, maybe as a part of that data adventure, the legislature often does out-year projections to determine whether or not a tax policy plan or a budget plan is sustainable.
Yep.
Can we look at out years that are typical that the legislature uses, maybe a FY29 or calendar year, whatever it might be, with this same information, assuming flat funding, and maybe not those enhancements from this year around public-private partnership, health and safety grants, and whatever the other one was?
Yeah, we certainly can. Some of it is on screen. I also have the entire history of the Key Fund. I think it would be useful to lay that out for you all at the retreat. Visually, it's interesting, it's informative, and you can see the trends back and forth when certain transfers began. Things get baked in and you feel like it's always been so, and that's just not the case. So I just would love to gather up whatever will help you all think through the approach to manage this in the future and get us back into a healthier trajectory.
If it's okay with the other board members, I'll just take my rando thoughts that I'm having in my head and just not think about a recommendation for today, but to hope and ask for a significant amount of time and information be provided to us at the retreat, so that we can then consider some thoughtful, first step, second step, third step kinds of concepts to make prior to this budgeting round coming up again. Thanks for the thoughtfulness of the staff in putting this together, because I mean, this is big, right?
Yeah. I would just put in a plug. I have taken notes. I know what we've talked about providing based on this discussion today. If there's anything that occurs to any of you as my board members, please ask. Please let me know. We can't. I have to be careful about reaching out. I don't want to break any of the open meetings rules and requirements, but you as board members can request information of me individually, and anything that I can prepare for you will be of benefit to the full voting board. So I would invite, it would be helpful to know, let's say by no later than mid-July, so that we have time to gather information. We'll get a running start on some of this, but if there's anything that occurs to you in the next month that you would like to have provided, I welcome that contact and those requests.
Got it. Thank you, Melissa, and I appreciate the invitation for information, and it's not even from you, it is an invitation, but I think for all of us, it's a responsibility to get the information we need to make the best decisions possible. And oftentimes it is nicely served up to us ahead of these meetings. But given what looks like to be the seriousness of the long-term health of the key fund, and then by extension, the CIF, we might need to do a little bit more interrogation of information in between these meetings. And so I will take you up on that. And just in terms of timing, if the board comes to an agreement that we'd like to make recommendations around direct transfers or something like that, we do have at least an August meeting, which is still roughly a month before agencies are supposed to submit their information to the Division of Budget. So that would give time for us to have a public or a vote on something that would impact other agencies.
Yeah, and at any time it's in order for you to make recommendations. It just becomes, more and more challenging as the process unfolds, because it becomes more of an outlier, and there are just additional steps involved. So that's all. This is our baseline budget recommendation for FY26. It is not etched in stone, and we can come back to address it later, certainly at any time.
Great. Thank you, Melissa. And what might feel like a shameless plug, I will say that KAC has a blog post on how the state budget works for any cabinet member, anybody listening. If you just go to kaac.org and Google how the state budget works, you will find a blog post with graphics and timelines and all kinds of things. It sounds like there aren't any other recommendations on the table from cabinet members, but I will pause to see if there are. All right, I'm not seeing any further recommendations, and thank you all for the support on the FY26 proposed budget. Melissa, I think we can move on to the Early Childhood Advisory Council portion of the agenda.
And this is really straightforward. I would remind that in 2020, the Children's Cabinet was named through executive order as the official Early Childhood Advisory Council for the state of Kansas, to be in compliance with the federal Head Start legislation. This is a requirement of every state. So we serve as that advisory council officially. However, the federal law also stipulates a certain number of positions on the advisory council be inhabited by particular representatives, and our governing board does not contain those particular people. So the executive order directed the cabinet to set up a standing committee that we call the Early Childhood Recommendations Panel, which offers advice and guidance to our cabinet in its role as the State Early Childhood Advisory Council. This is the panel requires the cabinet to adopt the membership slate for 1-year terms of service. We, because of the timing of the establishment of all of this, we follow the state fiscal year calendar. So we are about to say thank you to a number of outgoing members as they wrap up their commitment to the panel, and welcome a new slate once you give your approval. So we can move on to the next slide. The panel membership will cover 2 slides. These are the categories in bold are the categories outlined in the federal law. So we work very hard to make sure that we meet all of the requirements. And we've got a panel that includes, the slate is 42 members strong. 29 of them reapplied to return for another year of service, and 13 others are new to the panel this year, which we're really excited to see the continued interest. We received a total of 51 applications. And so this slate does involve some coordination to make sure that we did not have too many representatives from any one organization, and that we have the appropriate geographic reach and range of membership to provide the most diversity of experiences to the equation. So you'll see we have to have certain representatives can you go back for a second? Certain representatives of state agencies, these are folks who are embedded in the state agencies in charge of the particular federal programs that need to be represented. Head Start, obviously it's the Head Start legislation, so we have Head Start representatives. We're required to have local school districts, institutions of higher learning, and a parent of a child currently receiving services in the state. We can move on. Representatives of early childhood care and education and developmental services. We again, we screened through to make sure family child care and center-based care and rural and urban and all of the things, you know, we want as much representation in this group as possible. So you'll see that list. And then there is an other category that gives us some flexibility, and we see lots of good partners stepping up to serve, which helps enrich the process. So this is our slate. We need a vote to adopt the slate of members for the coming year. So John, I'll turn it back to you for any discussion and a vote.
All right, thanks, Melissa, and thanks to all who helped coordinate and facilitate over the last year and plug all the right people into the right spots for the year ahead. To kick off discussion, let's look for a motion.
So moved as presented. Monica.
This is Deanne. I'll second.
Thank you, Deanne. We have Monica with the motion, Deanne with the second. Open it up for discussion.
Hello, this is Dr. Smith. Just for my edification, I was just wondering, how are people selected to serve?
We have an application process we brought you earlier this year. We make sure that we publicly identify that the application is open. We put it in our weekly newsletter. We talk about it on our webinars. We have partners make sure that they have the ability to share out that news with their networks, and it's on our website. So we take applications and then we screen through those applications here at in-house. It's handled by staff and brought to you for approval.
Thank you. And I'm also wondering, in the process of screening, I'm presuming also looking at the diversity of thought, because I saw there's a diversity of agencies and childcare facilities identified. Am I correct in that understanding?
Yes, we want to make sure that in that provider category, we aren't only showing center-based providers, that we have made sure to take some care to ensure representation from a variety of sources. We've got representation, in various categories for certain populations, children with special needs, etc. So there is a lot of thought and care put into making sure that the panel is as diverse as possible. And I would say it's not typical that we keep an annual application window, but there have been years where someone has asked to step down, or we have identified a gap and somebody willing to fill that gap. So we have had mid-year replacements happen, but generally we do an annual application process for some continuity.
Thank you.
Melissa, if I could build upon Tyler's question, it's also thinking about, does the federal law, Public Law 110-134, obviously has requirements for categories like we are fulfilling. Does it have any other requirements or recommendations or practices, racial, ethnic diversity, income level, socioeconomic, anything like that?
I don't believe so, but our application does ask applicants to self-identify so that we can take those attributes into consideration and ensure that we are making appropriate decisions. So we strive for diversity of thought and opinion on that panel because it strengthens the work they do.
Thank you.
I would say the the category that is annually the hardest to fill is the parent of a child currently receiving services, because as you imagine, if you are a parent of a child who is currently receiving services, you probably are fairly time limited and don't have the bandwidth to step up and agree to serve on a state level committee. But if anyone knows of a parent who might be willing and able to attend one virtual meeting a month and participate on working groups as needed, that is an area where we would love some recommendations and some assistance.
Melissa, a quick question, and it's Deanne here. What has generally been the outreach to parents? And is it from
through the network of programs that we partner up with? It obviously, if you have a child that needs Part C services, you have your hands full and probably don't have a lot of time to step up and serve, but you are exactly the parent that we would benefit from hearing from. So we look for other ways in the absence of a full-time committee member. We do look for other channels of communication through programs that can contribute surveys and feedback as needed.
Thank you.
And Melissa, one last question from me at least, is just so I understand kind of all the nesting Matryoshka dolls here. So the Children's Cabinet essentially, in Kansas, the federally designated Early Childhood Advisory Council is doing business as the Kansas Children's Cabinet and Trust Fund. And because the Children's Cabinet doesn't have the necessary categories, we have then kind of outsourced that, created this advisory panel that does meet those recommendations. But the cabinet is technically the pseudonym is the Kansas Early Childhood Advisory Council.
Yes, and there's work that goes on all year long that often ends up in solutions that people can self-help and self-correct and don't need a lot of change. Like, it's just realization that a different approach might actually solve certain barriers or the need for additional information or whatnot. We use the allinforkansaskids.org website as a central location for information to be shared and tools and toolkits and resources to be made available. And there's a lot of activity that has helped inform the content of that website that doesn't rise to the level of a formal recommendation. Anytime they have had a formal recommendation that bubbles up from the work of the recommendations panel, it comes to us, and we have entertained those recommendations. It's been few and far between. It's just, we're not looking to make work. We're not looking to insert ourselves. Sometimes it's realization that, oh, this needs to go to the State Interagency Coordinating Council and let them take this up or whatever. There's a whole network of governance groups. So it's just we do an annual governance summit that is a report out from all of the variety of existing committees in the ecosystem, so that we all come together in the panel annually to compare notes and figure out if there are things that we can do to support each other. So it's just an effort to organize the information sharing and approach to things.
Thank you. I appreciate that. Before we get to the closing on the motion, I guess I do have one final question. Are those recommendations panel meetings open meetings, or could one of us cabinet members observe them just to soak in?
Yep, they, just like these meetings, they are held virtually. They are live streamed as they happen. They are recorded and they are posted on the Children's Cabinet website under there's a panel page on the cabinet website, and on YouTube we have a Children's Cabinet channel of our own with different categories. So
like and subscribe. Great. All right, Monica, do you want to close on your
I close.
motion? Okay. We are going to vote on the panel slate recommendations, the slate of members for the early childhood recommendations panel for the fiscal year ahead. All right. John Wilson, yes. Dr. Tyler Smith.
Yes.
Monica Mernan.
Yes.
Deanne Owen Graham.
Yes.
Dr. Leetta Felter.
Yes.
Senator Renee Erickson.
Yes.
Thank you so much. The motion is approved.
Mr. Temporary Chair, can we forego agency updates today and collect written updates that we can include in the minutes in the interest of time? I know we are going to lose members this morning before all of the business of the day is taken care of. So are you okay with that? And apologies to our agency friends, but if you could send us, as you have in the past, written updates, we would appreciate that.
Yeah, I am good with that. I'm looking at body language of the board members who are on camera, and it seems like we're good with that.
Okay.
To Derek Flurlog, please keep practicing that musical number you were going to do for that update, and we look forward to it at the next one. So Melissa, we'll move into your updates.
And I will try and go rapidly through this. We wrapped up the 3-year preschool development grant, renewal grant that we had enjoyed administering. April 29th was the last day of the no cost extension period, and that grant and all activities have been brought to a close. The last remaining piece of business is the drafting of the comprehensive report that will be shared that is required to send to the Administration for Children and Families so they can share a report to Congress. We are working in the planning grant phase. We are working on an update to the All In for Kansas Kids strategic plan. You have previously seen the updated 2024 needs assessment a couple meetings ago. We're using that to inform updates to the strategic plan, marking progress where we've made it, and charting the course for the next 5 years in partnership with KDHE, KSDE, and DCF. So we will bring you at the August meeting the draft strategic plan and take feedback from the board. We also were notified by the federal officers that we are eligible to apply for a renewal of preschool development grant funding. We are in a category that would qualify for up to $7 million a year for a 3-year period to continue the work of All In for Kansas Kids. No guarantee. There are 25 eligible states and 10 awards being considered. So we will be submitting an application to see how that goes, and we will keep you all posted. It would be continuation of the strategies in place to support the early childhood ecosystem and finish certain projects that we're excited about. The CBCAP community-based child abuse prevention program, we submitted our application to the federal office for renewal of that funding. It's an annual cycle, and we will find out. Usually it's not until close to the end of the current fiscal year in September, but we'll keep you posted as soon as we hear anything from the feds. We are in the process of taking competitive applications for the new round of CBCAP grants, and the applications we're taking is for grant funding that we've already received from the feds. So we are not trying to, if I have that life cycle right, I could be wrong, but the RFP is open, the applications are being accepted, and the cabinet will make grant award decisions at our August meeting. Our Child Care Capacity Accelerator and our Capital Projects Fund grantees are in full gear. We have seen groundbreakings and ribbon cuttings. We've got programs that are open or opening for business this summer. So we're starting to see the fruits of all of this work, and it's just been really gratifying to start celebrating some wins and successes in the realm of childcare. So I can't get everywhere to every one of these ceremonies, but I have certainly endeavored to get to some as schedule allows. And so I know we've cut the ribbon at Hilltops Extension in Lawrence. That's an additional 100 slots for kids, roughly. We've got Great Bend opened their center last month. The soft opening over the course of the summer to be ready in August for both of those programs. I think in July, Hayes Med is cutting ribbons or breaking ground. One of the, I think it's ribbon cutting. We've seen centers large and small. We have a frontier area of the state in Montgomery County, expanded capacity for 9 more children during non-traditional hours, which is what they need in their community. We've got a program that's opened a duplex. Both sides are childcare programs. So we are all in for all types of providers in as many ways as possible, and have just an ongoing list of progress in those grant programs. The accelerator is a complicated program that we brought together 4 different funding sources, and we are wrapping up the eligible period for one of the key sources of funding was the Child Care Development Block Grant, ARPA discretionary funds, June 30th, and maybe like we are in the wrap up phase of the eligible period to incur expenses that can be reimbursed with those funds. So we've been working very hard to help our programs understand the timelines and the last date to submit their invoices to us. But there's just been lots of success in that program. We are working on a more detailed report to the board for a later meeting this year to really help read you in. And if you're interested, when I receive invitations to events, I would be glad to share with the board. And if they happen in your areas, I think it would be nice to see members of the cabinet supporting the work. The final thing that I want to bring attention to, as part of the strategic plan, we will be bringing the board a refresh of our blueprint for early childhood. The blueprint has been in place with this cabinet board for long before I arrived. It prioritizes investments around healthy development, strong families, and early learning. We are refreshing it to update the language that we use. We want to refer to the ecosystem for early childhood. We are just modernizing the way we refer to, rather than always saying stakeholders. There's just certain word choices that we want to refresh, but the fundamental change, the 3 pillars will not change. We will continue to base all the 3 building blocks will continue to be central, but we've recognized the importance of thriving communities as sort of the basis for the work that's done. So you'll see a new dimension to the blueprint for your consideration and approval. So just wanted to give you a heads up on that. As mentioned, we will see a change in membership. This was Delisa's last meeting. We will welcome Representative Christy Williams as the new speaker's appointment to the board. That appointment will be effective June 20th, so she will participate in all subsequent business of the cabinet after that point, and look forward to welcoming her when she's actually with us for a meeting. And just, setting the course over the summer to help reset. We issue early childhood block grant paperwork, all the agreements this month. prepped and ready so that we're good to go July 1st when the new fiscal year starts. Those were previously approved by this board at our April meeting, and managing the work with our grantees throughout. So my small but mighty team here at the cabinet is ready to assist when you have questions. And that's it.
Thanks, Melissa, for your update. Does anybody have any questions for Melissa or reactions to her update? Melissa, you mentioned the small and mighty team that does great work at the cabinet, and by extension, our partners that also help with evaluation and other data needs. How are things going with the kind of intent to fill open positions and that sort of thing?
We're doing an internal review, top to bottom, of existing role and responsibilities, gaps, challenges, just doing an analysis so that we can make a smart decision about the talent that we need to hire to help supplement and enhance the existing operations. So rather than just throwing an existing job description back up online, I really wanted to pause and take stock of where we are, what we do, what we need, and the challenges that need to be addressed. So losing Amy was a big loss of talent to the cabinet. She has a lot of skills that the private sector is benefiting from in her new job, and so I want to be thoughtful about how we address filling that need.
Thank you. And I'll say that I understand the challenges of managing so many things when you are short-staffed, and want to recognize that we don't want you to be burnt out as the director of the agency. And so I certainly don't want you to rush through creating a job description and hiring somebody, but also just want you to be mindful of your own of not burning out yourself, and that would not do anybody any good. And so if we as a board can be supportive as you craft any future job description or are looking for a candidate pool, if we could help promote that, we will.
Thank you so much. I appreciate that. Yeah, I think it's not work that's burning me out at the moment. It's life. I've got an ailing father, and there can be days. So I appreciate that acknowledgement.
Yeah.
But this work is rewarding, and I appreciate working with all of you.
Yeah, you bet. And we'll continue to think about you and all that you are managing on the things outside of the 9 to 5 ish.
I wish.
Okay, if there are no further questions or comments,
I will let me just do some housekeeping. We are going to adjourn this meeting, and then those of you watching who wish to continue watching on our YouTube page, you will see the ability to follow along the first meeting of the Dolly Parton, the Imagination Library of Kansas. We are holding the organizational meeting of the 501c3 nonprofit entity. So we wanted to make that meeting available. It is, I don't know that we're doing anything terribly exciting. It's a lot of housekeeping that is required by law, but we will be sharing that meeting with you all. So we're going to wrap this one. Board members, you have a link in your email. Lindsay is the keeper of all things related to Zoom meetings. So if you have trouble finding it, we can put that. Lindsay, why don't you just go ahead and put that at the top of everyone's inbox. So John, I'll let you carry out the closing business.
All right. Thank you, Melissa. And thank you to all of the cabinet members who attended the meeting today, and for everybody listening online and participating virtually. Really appreciate you following along. At this time, I would entertain a motion to adjourn the cabinet meeting.
This is Deanne. I'll make that motion to adjourn.
Thank you, Deanne. Is there a second?
Deetta, second.
Leetta for the second. Thank you so much. Any discussion? All in favor, voice vote? Aye.
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 All right. See you all shortly. And for those who want to follow along, see how a star is born, a nonprofit is born.